Hey guys, it is Wednesdays with Chasey Poo, and I am definitely not naked right now. I'm actually not naked, I'm wearing underwear. The usual. Today, we are talking about health, physical and mental. And this is kind of a vague topic, and I like it, because I kind of want to talk about healthcare practitioners, healthcare providers. I don't know why that word came out of my mouth. Healthcare providers. And their lack of knowledge on trans issues. So, because I guess I can't really talk about health like physical and mental. I'm not okay, I'm depressed and anxious. Physical, I'm trying to be okay, but it's hard to run when you're depressed. So that's my update. So let's talk a little instead about your overall health and the way that your health is being treated as a trans person. I think about mental health and mental health professionals who are supposed to be there for you and help you. And I have had so many instances where I have gone in for bottom dysphoria and a therapist literally shot down two of the most things that I thought were gonna help me the most. So I was very dysphoric about peeing sitting down, and one of my cis guy friends told me that he sits down to pee and he knows a couple other guys who sit down to pee, and I was like, oh my god, that makes me feel so much better. And the therapist goes off and says, yeah, but that's like really rare. What? Why would you say that to me? And then I had a lot of dysphoria about like not having a peen, and I was like looking at men that who have a micro penis makes me feel a lot better about myself, and I feel like I can relate more and they can relate, and it was just interesting. And he's like, yeah, but don't you think it's worse for them though because they have the equipment? All around me. Why? Why would you say, somebody is telling you that this is helping their dysphoria and you're like, hey, by the way, whatever you're thinking in your head, you're wrong. Why would you do that? It was very inappropriate, and I thought that, and that's maybe like, that's not like, oh, he didn't know anything about trans things. It's more like, it's like therapy 101. Don't shoot down the idea of someone. But anyways, I have had therapists who have been very against the whole trans thing and have literally said, oh no, I don't deal with that. And that really hurts, because you're going to someone for help and they refuse to see you, and it takes months to get appointments with other mental health professionals. So what I recommend actually is to go online and try to see if there are therapists near you that have good reviews, and that if people around you know if the person has good reviews also, because holy moly. And then if we talk about the physical health, I have too many stories honestly where doctors have like said really inappropriate things to me about the surgery and having surgery and being trans, and a doctor asked me when I'm having the surgery once. I'm like, that I'm not here for that though. I'm like, I was there for like something with my knee maybe, or my foot, like not relevant. And I know some people get mad and they're like, your doctors need to know everything about you. Well, my doctor does need to know everything about me, but these are not my doctors. These are clinic doctors. This is an emergency and I need help right now. For my knee, for my ear, for my eye, for my anything. It has nothing to do with me being trans. And if they had asked, have you had any surgeries in the past, because they need to know that and it's relevant to what they're doing, then yes, I will tell them. But because I mentioned that I was trans, or I was transitioning during going to this specific clinic, it's in my file. And when I tell them I'm on androgel, they're like, why are you on androgel? So it just sucks that people judge and they just don't understand. And instead of being, there's a line, and instead of being like helped, you are now being asked questions out of curiosity. And it's not to help you, it's to help them feed their curiosity. And that hurts a lot, to be poked and prawn whatever and whatever. And it makes you feel like you're less human, and like because you're different then you're kind of like a freak. And man, that feels horrible. I literally had a doctor once, I think they wrote it wrong in my file or something. It was when I had a catheter for 2 months because I had a bladder infection because I held in my pee for too long. Trans problems. The doctor looked at me, looked at my file, looked at me again and said, so do you still have your penis? Excuse me? I wish. Like, what the fuck kind of question is that? Someone when I was a trans woman? What the fuck? How insulting is that if I was a trans woman also? Why the fuck? I get it, it's a catheter, you need to understand what genitals I have, but you don't need to ask. I feel like there are other ways that you can say that. Like, I need to check on the catheter site. Are you comfortable? You don't need to know what genitals I have. If you're a fucking doctor, I'm sure you've seen both and all of the other genitals, and it just makes me mad. And I don't mean both like men and women. I mean like both sets of genitalia that is dominant in society, including like other ones like intersex that are less dominant. And I get it. I understand that this I don't know. I just felt like shit, and that whole experience was just horrible for me, especially because I was 6 months on T. Whatever. But I feel like once again, there is such a lack of education for healthcare professionals, and they don't even know what trans people are. And yeah, the media is really great now, and like more people know what trans people are, and it's like fantastic, yay. Caitlyn Jenner, oh my god. But there's still a problem where we're still not seen as human. We're just seen as like, we're an experiment because they've never seen a trans person before. And it's like, oh my god, I finally have one in my office. And it's like, what do you do when you have one in your office? You ask them questions about their fucking genitals and what surgeries they've had and if they're gonna go all the way. What does that even mean, all the way? The fuck? Fourth base? Like, are we having sex? Whatever. Anyways, I know kind of off topic, but I didn't really know how to interpret this topic other than that. So, bad healthcare professionals. Yes. I love you guys so much. Have a great week. Bye.